Thank you. Hi, everyone. I'm talking to you from snowy New Hampshire. I was hoping to be down there with you today, but nature took over today and we're getting quite a snowstorm. So I'm happy to be here. I want to just say thank you to Less Cancer and to Bill Cousins and Tom Sherman for all the hard work they do around preventing cancer. It's really important. And I got to know Less Cancer and Bill and Tom a few years ago, like Tom said, when we discovered an issue in our community where children were getting cancer at very high rates, higher than expected rates, these rare cancers. And it really, if you had asked me a few years ago about what I'd be doing right now, it certainly would not be sitting in front of you talking about this, having been elected to the New Hampshire House and running for Congress, because it was just never in the cards for me that I knew about. But I think it's important to know that when people are active around issues that they are passionate about, it's really important to get involved. And that's what happened to me a few years ago. Like Tom said, I was a mother of 2 teenage boys and a small business owner in the environmental consulting field. I knew that these rates of cancers in these children were higher than should be expected. I was also taking clinical and translational science at Georgetown and just finishing up that degree now. So I had some epidemiology and other sorts of academic backgrounds in my background to understand what that meant. So, as a result of the cancer cluster being identified as a double CDC-defined cancer cluster, I started to get involved with the task force that Governor Hassan formed with Dr. Sherman and really started to look at cancer and chronic disease in the community I lived in as well as across the state. And when Dr. Sherman asked me to take his place and run for office, at first I asked him if he was crazy, but then I thought about it for a little while and I thought, he told me one of the first things he said to me was how important it was to have scientists elected to office. And at first I didn't understand that and I didn't feel that there's a place for it. But as I started to talk to my community and people across the district, I realized how important that could be. And I was very happy to be elected in November. Then, as Tom said, the task force was concurrently working at some of these issues that could be environmental triggers for the cancers. And I learned a lot of stuff along the way about cancer, and I learned a lot about our environmental habits over the 20 plus years that I was aware of. We found a very big Superfund site that was an old landfill. Back in the 70s, you would just dig a hole and throw stuff in it. Anything and everything went into this landfill that's situated geographically central to the cancer cluster, and now is contributing to very high levels of perfluorinated chemicals in surface water and in groundwater around the landfill. So my background in environmental studies really contributed to my being able to help understand this important issue. And the other thing I found out as I was looking at it was that the state of New Hampshire has the highest rate of breast cancer in the country, as well as the highest rate of bladder cancers, one of the highest rates of bladder cancers in the country. And those 2 cancers, plus these rare cancers, are possibly environmentally triggered. So I think all of this environmental issues, overlapping with cancer are really important to look at. And the other thing I learned is that I was unaware of a very large release of these perfluorinated chemicals in an area of the central portion of our state. And looking into the history of how that happened, I realized that the company actually came to New Hampshire from Vermont, closing down shop in Vermont, because New Hampshire had much less strict regulations around drinking water and soil protections and air emissions than the state of Vermont did. So all of these things together really made me understand how important it is to have scientists and activism in areas around preventing cancer. And as Tom mentioned, 3 bills that I put in my first year passed. One of them is creating the permanent task force as a commission now that Tom and I serve on. There was another one which is looking at just strictly drinking water and groundwater protection across the state, across the seacoast area. And that's a really important commission as well. We're really looking at ways to make sure everybody's aware about chemicals and how we need to protect our groundwater. Because the seacoast of New Hampshire is a pretty a tourist attraction, and lots of people want to live here, but there is a real danger now for drinking water shortages. So this is something we really need to importantly look at. And the other commission that Tom talked about was this innovative model, which I'm very happy that we're making some good progress on. And I think that this model for overlaying environmental issues with cancer and other chronic disease will be really a model for other states to pick up on and actually look at preventing chronic disease and cancer if we're successful at creating that model, which I think we will be. Another thing that there was another bill that I put in the first year that I was elected, which didn't pass. It got actually retained in finance, and it was supposed to lower the acceptable limits for perfluorinated chemicals in drinking water. And that was difficult to handle. It took a lot of education of other legislators. That bill was retained in finance for a year, and I had another attempt to also do that in another way. But what that did was, it was really important, that process, even though it didn't pass right away, was to educate everyone. And now everyone in the State House is more aware of drinking water in general, but also of these perfluorinated chemicals and how important it is to keep chemicals out of our drinking water. So that was a success. That bill actually has just passed and is now going to the Senate. So it was a little delayed after the other three. But so I just this year I also have quite a few number of bills in, all looking at pretty much a lot of them looking at protecting groundwater and chronic disease prevention. I have a bill right now going through that looks to reduce arsenic levels in drinking water, which we know is a poison and have known that for a long time. That has hit some very big opposition, but we are still going to push through, and hopefully we'll have some reduced level for arsenic in our drinking water. And that's directly tied to bladder cancer in some cases and other types of cancers. There's another bill that I have put through which allows private citizens to sue for exposures to toxins in the workplace and in their drinking water, and that one is working its way through. So there are many ways that scientists can be involved in preventing illness if they get involved in the legislature. So it's really important for everyone to be actively engaged. I heard a lot of conversation earlier from the panelists about this issue, and I really am a full supporter of anyone who's has the interest to get involved. It can be running for office, but it can also be just as simple as emailing representatives who are involved with passing legislation, or calling your representatives, or writing letters to the editor about how important certain legislation may be to you. I heard some earlier conversation about pesticides. I was involved in trying to get a bill through to limit the use of pesticides on daycares this session. We faced heavy opposition from industry people, and that bill actually ended up getting killed. And the crazy thing, you would not believe the level of lobbying by the industry against efforts like this. There was a flyer that I found on the last day where we voted on the House floor about it, where it said crabgrass and grass blades, if not properly treated with pesticides, will cause a tripping hazard for children. This is the level of lobbying. I have a small bill that went through that was trying to last week prohibit the use of crumb rubber on play fields, which is basically ground up tires. It's an ingenious approach that these industry people have developed. They can't put tires in landfills any longer because they're hazardous. But what do? They make them into this crumb rubber, they chop it up, and they put it on play fields. But now we're seeing likely higher levels of cancer in some soccer goalies related to inhalation of these dust particles when they're playing soccer. So that bill was fought heavily. There were 7 lobbyists flown in from across the United States to fight my little bill, saying all sorts of things about there not being any evidence from exposure, that grass blades might be high in lead. So I'm just using these examples to show how important it is for people to become active in really trying to get protections for public health passed on the legislative level and in your community. So I'm an example of someone who stepped up to run for office. I was asked to run, and I'm so thankful to Dr. Sherman for having done that, because I'm really passionate about how I can use my scientific background to reduce rates of cancer. And I want to, again, thank Less Cancer and Bill Cousins. And just it's really empowering to people, I think, to know that their voice really matters. So thank you very much.